Well, let's unleash the challenging case 19. Now, most of the viewers they diagnosed it correctly. This 50 years old female patient presented to me with complaints of severe foreign body sensations. She said that it seems that when she closed the eyes, needles are inserted into the cornea. There was photophobia and decrease of vision as well. She was diagnosed case of rheumatoid arthritis. I showed you the hands. Whenever someone shows you the hands, if there is no obvious injury or imputation or polydactyly, look at the joints, and there were swollen joints, and she was taking medication for it. She went to many ophthalmologists, and all gave her artificial tears during the day and ointment at night. And one ophthalmologist also applied bandage contact lens, and for the time being her symptoms a bit relieved, but then she got infection because in a severe dry eyes, if you don't change the bandage contact lens after 2 to 3 weeks, there is increased chance of infection, so it was withdrawn. Now I saw dry eyes on slit lamp, and I also saw filaments on the cornea. As you can see, I have stained the cornea with fluorescein, and it has also confirmed that this patient is a case of filamentary keratitis. Now, what is filamentary keratitis? Filamentary keratitis is a condition of severe dry eyes in which strands or filaments composed of degenerated epithelial cells and mucus develop on and adhere to the cornea, causing pain, grittiness, and severe foreign body sensation. Now, it can be associated with aqueous component of the tear film deficiency, as in keratoconjunctivitis sicca, in a leg of ophthalmos, with corneal exposure, in facial palsy, in a third nerve palsy with total blepharotosis, ocular surgery in an already compromised cornea like LASIK, phaco, TRAB in a severe dry eye patient, systemic diseases like Sjogren's syndrome with dry eyes and dry mouths. Now, most of the viewers they commented they diagnosed it partially as a case of filamentary keratitis, but then deviated towards Sjogren's syndrome. Now, my question is, if it was a case of Sjogren, then I would have shown a dry mouth, a dry tongue, along with the dry eyes, instead of joints and hands pictures. So, another condition which this patient had, rheumatoid arthritis, also present with dry eyes as well as peripheral ulcerative keratitis. So, in challenging cases, you have to correlate all the signs shown in the video to reach the accurate diagnosis. Other causes are extended use of anticholinergic drugs. Now, question arises why we see mucous strands on the cornea in filamentary keratitis. Well, answer is that there is increase in tear film mucous to aqueous ratio. Now, this change brings the formation of mucoid filaments, and as epithelium is defective, so epithelial erosions, epithelial defects provide an anchoring surface for the filaments. Now, mucin attaches to the epithelial defect, and loose epithelial strands are incorporated into the mucin strands attached to the surface. Now, blinking causes these areas of detachment to become elevated, leading to irritation, inflammation, foreign body sensation, and increased mucus production. Filamentary keratitis is a secondary phenomena and is always related to an underlying condition like severe dry eyes due to Sjogren's syndrome, rheumatoid arthritis, medication toxicity, keratoconjunctivitis sicca. So treat that underlying condition and it will improve. Symptomatic treatment is ointment at night and artificial tears, preservative free during the daytime. And if it is not helpful, then bandage contact lens is added to the artificial tears. but also then add topical antibiotics as well, because I have already told you about the chances of infection. Now, this patient was on this regime when presented to me, so I prepared mucolytic drops, 2% N-acetylcysteine drops 4 times a day. Now, viewers can argue that in literature 10% is mentioned, but practically 10% is intolerable, too much concentrated, too much stinging, unbearable. So, in my practical experience, 2% drops are less stinging, tolerable, and efficacy is comparable to 10%. With 1 month therapy of mucolytic drops, the symptoms a bit improved, but not significantly. I have got the other options of temporary manual removal of filaments on street lamp and punctal occlusion to relieve dry eye. And another good option was amniotic membrane grafting. So I applied amniotic membrane grafting and the symptoms dramatically improved. I will show you the video of how to implant amniotic membrane graft in such patients, and she's also taking rheumatoid treatment as well. So that was an interesting case of filamentary keratitis as a challenging case.